I'm Claire DeMatteis, Commissioner of the Delaware Department of Correction. This is a challenging time for every Delaware family, and we want you to know that the Delaware Department of Correction is taking extraordinary steps to help protect our correctional officers, probation officers, educators, counselors, medical professionals, contractors, and staff, as well as the individuals in our custody from the spread of this coronavirus. To date, we have no known cases of COVID-19 in any DOC facility or probation and parole office. Over the next few minutes, DOC's Medical Director, Dr. Maduka-Ezeh, and I will highlight the preventative measures we have implemented in all of our facilities and offices. In January, we began enhanced medical screenings for individuals held in pretrial detention and sentenced offenders in our facilities during the flu season. In February, we increased these screenings as COVID-19 spread to the United States.
Inmates who arrive at our facilities receive a medical screening to assess their healthcare needs and to learn about any potential exposure to COVID-19. Since mid-March, all inmates who have arrived at our facilities are being carefully monitored every day by medical staff for 14 days to look for signs of illness.
We are thoroughly screening every single person who enters our prisons, work release, and violation of probation centers and probation and parole offices. They are asked specific questions about their medical condition and whether they have had any direct or indirect contact with someone who has been tested for COVID-19 or is in quarantine. And they receive a forehead temperature check with a thermometer. Anyone who exhibits signs of illness is turned away and directed to consult with a doctor. We understand that every offender in DOC custody is part of a family that lives in our community. On the day that COVID-19 arrived in Delaware, we temporarily suspended in-person visitation to help keep inmates and their families safe and healthy, and to support the social distancing that public health experts say will make a difference in slowing the spread of this illness. At the same time, family support for the men and women in our custody is more important than ever. That's why we are taking new steps to help them keep the lines of communication open, including providing 2 free 5-minute calls each week for every inmate so that they can check in on their loved ones and family members. We also are making sure that the individuals in our custody have continued access to phone calls and, where available, video visitation services.
The Delaware Department of Correction and its dedicated medical professionals know how to combat infectious diseases, and we have a track record of doing it successfully. In fact, we have successfully prevented widespread outbreaks of infectious diseases like influenza for 3 consecutive seasons in all of our correctional facilities. That experience and our robust planning efforts are helping us to respond to the threat of COVID-19.
If and when the COVID-19 virus impacts one or more of our facilities, we have detailed plans in place to immediately isolate an inmate to prevent widespread contamination, just as we do during every flu season in our DOC facilities. We also have plans to convert vacant DOC buildings into COVID-19 treatment centers if necessary. Please visit doc.delaware.gov for the latest news on our COVID-19 response, and follow us at DE Correction on Facebook and Twitter to stay in touch. We want to especially thank correctional officers, probation officers, our medical team, educators, counselors, and staff for going above and beyond to keep our facilities operating 24/7 and for remaining committed to our public safety duties through this international health crisis. We are all in this together, and together we will help slow the spread as the Department of Correction continues to meet our dual mission of public safety and second chances. Please stay safe and healthy.